Welcome to our training video on ethical guidelines. The video is presented by. The major ethical issues in healthcare include privacy and confidentiality issues, assisted reproduction technology related issues, patient right violation. First ethical issue is privacy and confidentiality issue. So, unappropriate access to patient information by unauthorized person is known as privacy breach. It is on EOF the most common cause of ethical issues in healthcare. Privacy breach result in harm to patient health and reputation and financial destruction. Now let's discuss ethical issue related to assisted reproduction. So, ART is utilized when natural conception is not possible. Ethical issue arise around creation, selection, disposal of embryo, as well as around the cost, coverage, access and resource allocation. Ethical issue is complex when third party is involved in ART. Now time to discuss patient right violation issue. Violation of patient right occur when healthcare provider fail to take consent of patient, fail to provide safe, quality care, isolating and abandoning patient, fail to treat patient with respect and dignity, administrating unnecessary treatment. Now, let's discuss reasons for ethical issues. Let's discuss reasons for privacy issues. Most common reason is human error. For instance, using weak password, or sharing password with unauthorized person, sending patient personal information to others. Other reasons include hacking, malware, old unupdated software, gaps in legislation, insider misuse, and trust issues in healthcare. Moving forward to reasons behind assisted reproduction technology related issues. Most common ethical issue is high cost on assisted reproduction technology. Because of uncovered service, high cost for services. For instance, in USA an IVF setting costs $12,400. Other reasons are lack of legislation. Due to this, provider can give treatment the way they want and also results in practitioner biases. Last reason is unresolved biological problem. Now reasons behind patient right violation include lack of knowledge about patient rights, lack of efficient policy and procedure, and last is lack of legislation. Let's discuss how to manage healthcare ethical issues. Let's discuss guidelines on managing privacy issues. First method is establishing new privacy techniques like de-identification to prevent identification and re-identification, encryption to protect patient information, conduct regular audit trail, ensure electronic consent, and implement layered access to patient information. Second method is providing training to staff. This helps in preventing future privacy issues and handling privacy breach ethically when arise. Third method is signing confidentiality agreement by healthcare staff which states that without patient consent their information cannot be shared. Next method is assessing privacy impact to identify and resolve healthcare privacy concerns. Last method is building patient trust. This helps in providing quality and safe care to patient. Now let's discuss how to manage ethical issue related to assisted reproduction. First method is implementing Health Canada's assisted reproduction technology policy. This helps in preventing commercialization and ensure that doctors follow standard policies. Next method is increasing public funding to support people who cannot afford expensive services. It's government responsibility to promote health equity. This funding helps in saving financial expenditure. Last method is strengthening Royal Commission to improve issue related to destruction, storage and selection of embryo. Guidelines on managing patient right violation include ensuring the right to health is recognized in Constitution, maintain patient respect and dignity, provide high quality, safe care, integrate national policy with rights-based approach. Now let's discuss lessons learned from pandemic and ethical impacts. First lesson learned from pandemic is building resilient healthcare system. Because in future healthcare system should be ready to combat the pandemic to quickly identify, evaluate and respond to new outbreaks. This can be achieved by strengthening good quality care, improving resource allocation and access to care, focusing on patient-centered care, promoting health equality and boosting patient engagement. Second lesson learned is enhancing healthcare security because recent pandemic affected human ability to achieve global well-being. The reason is significant increase in cyber attack on patient information. This affected patient health outcome. This issue can be solved by encrypting all patient data, educating healthcare staff, because this helps in increasing patient satisfaction and reducing patient harm and financial burden. Third lesson learned is addressing ethical disparity in healthcare. Because COVID-19 pandemic exacerbated pre-existing racial disparity, resulted in poor health outcome and increase in mortality. It is government responsibility to promote anti-racism, health equity, and employing standard policies and procedures. We believe that lessons we have learned from the pandemic would improve hospital care delivery in future emergencies. Thank you.